Thank you very much, Chair Clyburn, and thank you to our witnesses speaking about the very important programs that were initiated in response to this pandemic. Mr. Horowitz, your oversight testimony had a link to it regarding COVID-19 testing. And this was COVID-19 testing that was done at federal agencies, so I realize that it's limited. And it was from February to August of 2020. And it indicates in that link that 10.7 million tests were completed at federal healthcare agencies at a cost of $659.5 million. And that was an underestimate because it doesn't include the VA. Would you have an idea of how much has been, how many tests or how much has been spent now on testing at those agencies or in general for all testing in the US?
Congressman, I don't have that with me. I can certainly follow up with my colleague at HHS OIG and see what the latest data is. We cut it off at that time so that we could obviously move forward and start doing analysis.
Well, the reason for my question is, as a physician and a former director of the Iowa Department of Public Health, I closely monitor what's happening with the number of cases, the number of hospitalizations, the number of deaths, the number of those who recovered who would have natural immunity, and then the vaccinations, at least here in Iowa. And given everything that I have seen since the vaccination was first approved in November, which is remarkable, and then now we have a total of 3 vaccinations, I've seen this decline very rapidly and exponentially and feel that we're very close to herd immunity. In this most recent American Rescue Plan for COVID-19, there's allocated $47.8 billion in testing and another $7 billion to go to community health centers for testing. And it seems to me that with the decline that we're having, that amount of funding may be excessive. Do you have any suggestion or comment on that?
So I wouldn't be in a position necessarily to comment on how much money should or shouldn't have gone. I'll leave it to other policymakers to decide that. I will say that what we found, and I've seen at DOJ, for example, because I have oversight over the federal prison system. And what we found a year ago, and in the first several months of this, was the absence of testing impaired the ability of the BOP to identify asymptomatic inmates so that they could segregate those individuals rather than simply wait for them to develop symptoms. And so we certainly think there will continue to need to be testing available, much like there is for other diseases.
And I think there's more recent data that shows that there is not the transmission in asymptomatics that we originally thought that was. I'm hoping that some of this money can be used in accordance with the bill that I introduced, HR 1897, that would do COVID-19 testing for those migrants coming across our borders, which is not done now. So thank you so much. Mr. Ware, I'm going to direct this to you. The PPP program to the individuals, both when I was a state senator helping small businesses get PPP, and then those I've talked to, has been an extremely successful program. And to be eligible, an applicant had to have not more than 500 employees. And because of large chains receiving loans designated for small businesses, the SBA had instituted an affiliation rule. If the parent exerted control or had power to exert control over the affiliates, the entirety of their employees should be counted towards that limit. So is having affiliates use the same bylaws as the parent exerting control?
We have not taken a look as yet into the how that works out and if it's the same or not. But
okay,
we did. Sorry, go ahead.
Are having affiliates apply for accreditation from the parent company exerting control, the parent company imposing performance policies on the affiliate exerting control, or the parent mandating certain services be performed at the affiliate? Are those things exerting control?
Without the work to actually dig into it, I'm unable to answer the question at this time.
Well, Planned Parenthood across the nation has 16,000 employees nationwide, but they got more than $80 million in PPP loans. Even their own lobbyists admitted that the rules made their affiliates ineligible when they said the CARES Act money had broad discretion to exclude Planned Parenthood. Has Planned Parenthood returned any of that money?
We have not taken a look at Planned Parenthood specifically. We have a series of reviews in the queue dealing with eligibility across these programs.
Thank you. That was going to be my next question, if there was a reviewing of the affiliation status. Thank you so much for your testimony. Thank you, Chair Clyburn. I yield back my time.